to an episode of Coffee Break with Card, La Hora del Cafecito Sister Show. My name is Lourdes Quiñones, and I would like to welcome you to the show. Coffee Break with Card is a program dedicated to all those in our community who are living with autism, to their family members, and to all those who support it. So come on in, join us at the table, and let us know if you're drinking a cup of coffee or tea or water or whatever. So sign on right there under the comments below, and we'd love to say hello. In today's program, we have the pleasure of having with us Colleen Blazina, who is a pediatric occupational therapist, and she specializes in feeding therapy. Colleen has come to share with us some important information and also engages in food art activity to demonstrate how to make mealtime a fun and sensory-friendly activity that could help reduce anxiety around mealtime and help to expand the sensory experiences of our loved ones with autism. So join us. This is in this fun and artsy sensory awareness, I guess, episode. We have a lot to talk about. And welcome to the show, Colleen.
Thank you for being here.
So let's start by introducing to you your coffee break hostesses for today. As mentioned, my name is Lourdes Quiñones, and I am a CARD consultant assigned to the primary age group, and professionally, I'm a pediatric physical therapist as well as a special education teacher. I'm joined by my colleagues, Jasmine Castellano. Buenos dias, Jasmine.
Buenos dias, Lourdes. Good morning, everyone.
And Olivia McDonald. Buenos dias, Olivia.
Buenos dias, in person.
En la casita, at home. Anyway, and we also, of course, Colleen Blazina. Good morning. Hello. And welcome.
Thank you.
Okay. So as you know, Jasmine Castellano is an excellent professional in the field of mental health. She is a CARD consultant assigned to the youth group from middle school to young adults, and a mother of 3, one of whom is diagnosed with autism. So again, welcome, Jasmine.
Thank you, Lourdes.
Olivia McDonald is an excellent professional in the field of public health, and she is a CARD consultant assigned to the primary age group, just like me. And Olivia is a mother of 2 and has a younger brother diagnosed with autism. Welcome, Olivia.
Thank you.
And of course, we're going to introduce Colleen and a little bit below and upcoming. So for now, I just say, again, welcome to the show. Before we get started, we want to review the rules we want to adhere by during this programming to ensure a safe environment for all of us. Remember to keep an open mind, use a positive attitude, and respectful language. But before we get started, for those of you who are just joining us, in today's program, we have the pleasure of having with us again, Colleen Blazina, who is a pediatric occupational therapist and specializes in feeding therapy. Colleen has come to share with us some important information and also engage us in food art activity to demonstrate how to make mealtime a fun and sensory-friendly activity that you could use to reduce your child's anxiety around mealtime and to help them expand their sensory experiences. So come on in, join us. We have a lot to talk about. So at this point, I'd like to get started with the first question, Colleen. So if you don't mind, can you tell us a little bit about yourself?
Sure. I am a pediatric occupational therapist. I graduated from the University of Florida with my master's in occupational therapy in 2010, and I've worked primarily with pediatrics as my full-time position. I've worked in the outpatient clinic setting, school setting, early steps, and now in private practice.
Wow.
Great.
Awesome. Lots of very diverse experiences.
Yeah, but kids are the best. So I just kept trying different settings, and I'm excited to kind of settle in on private practice, working in the homes with families.
Awesome.
And Colleen, so what is everyday progress? Can you tell us a little bit about it?
Sure. So I wanted to make therapy different when looking to start my own company, being a therapist for over 14 years. I've seen it in all the different settings, and I felt like something was lacking, especially with feeding therapy. So working in a clinic setting, oftentimes caregivers are in the lobby and they get just a few minutes of the therapist's time at the end of the session. Here, quick, try this at home. And it was very difficult for parents and caregivers to have carryover. Oftentimes, too, the child responds differently to me in an office and then for their parents at home. So although the strategies were successful Here, they couldn't see the carryover at home, which that's where it matters. You
Right.
want to see feeding progress at home the most. So I wanted to develop a therapy model that was different. And so going into the homes I felt was best to support feeding goals and feeding therapy, mostly because you can get caregiver involvement right away. They're learning alongside you instead of with just a brief overview or summary at the end of the session. I'm giving hands-on training and tips and tricks to the parents while we're doing the activities, which I feel like makes the difference.
Wow. Yeah, I can definitely see that. So what are some of the reasons that would explain why children with autism can be picky when it comes to eating certain foods?
Yes, so their sensory system is different than ours. They process their environment different than we do. So they are going to have those sensitivities, those sensory needs, aversions. It makes it difficult for them to interact with their environment. And food can be very challenging as a result of that. The smells, the way things look, the texture, it just being novel or non-preferred just can be a barrier where they don't know how to interact, don't want to be around. And that's why with Everyday Progress, I want to incorporate that caregiver training to help them understand why their child is processing things the way that they are and finding strategies to kind of come together and expand their interactions with foods.
Yes, and that is what you're doing is so important. Like and in previous show, like my daughter, she participated in feeding therapy for years, and something good about her therapist was doing what you're doing. I mean, it was not at home. I did take her to a clinic for her to get the therapy, but I was there. So, and I was able to learn, and she will teach me some of the things that she was doing during therapy, and I was able to carry that on at home. And even though she's now 16, I still use some of those strategies that I learned whenever I want to introduce a new texture and a new food. And it really works.
Because you had that caregiver support.
Correct.
And you had a therapist that was able to give you those adequate tools and use them at home, which makes all the difference.
Oh, yeah, definitely. And if parents believe that, but that was working when they were little. No, it still carry on throughout the years. Whenever you want to introduce new textures or new food. So anyways, are there any strategies, Colleen, that you will suggest for parents that they can implement at home to assist their loved ones with autism to overcome some of their food aversions?
Absolutely. So the best thing, and kind of this is one of your strategies that you learned, the best thing that you can do is reduce pressure. So the dining table ends up being a very stressful place for the child and the caregiver. The child knows, my mom wants me to try this new food. The parent is worried, are they going to try this new food? So it becomes a really challenging place for both parties. So when we can reduce the pressure, that is number one. And I will tell parents all the time, I want you to get comfortable saying you don't have to eat it, which for some parents, it's mind-boggling, but we need to start with no pressure. So the child can feel confident to explore, but not have to eat, because there's so much learning that happens in exploring with the food that the child builds on that experience and then may feel more confident to taste or possibly eat and try. So one of the ways I really like to set that up for parents is through food play, food art, where it's casual, it's low pressure. We're just interacting with the food without it being, here, try a bite. That's not a strategy that I work on. So you may, and I want it to be easy for families too. So you don't have to go to the grocery store with your list of special ingredients that you need to buy. Just open your fridge. Open your fridge. That's what I did this morning, to gather some items and leftovers, some produce that they can get involved with, is kind of all you need to do. I want it to be simple. And while you're doing these activities, you're also working on their confidence. You're building their independence. We're doing chopping, stirring, mixing, all at their levels. So I work with families to assess their motor skills, their bilateral coordination, what can they do successfully, and educate the families on a particular activity that would be best for their skills.
Yeah. And you know what I like about that idea, and I actually, when I had my clinic, I actually used this type of approach, because one of the things that I found as a physical therapist is a lot of times children will not try a new food, a new item, either because of any of the senses, but a lot of times one of the senses that leads is the visual sense. So they might, and it's very aware that, I mean, it's very legitimate to think that it's because of olfactory, it smells different. I had one of my clients, the mom, she only ate this particular yogurt.
The brand,
Yeah, and so the mom, when Walmart was out of it, the mom would try to fake her out and put another one in the container that looked like it, and the child would just go, yep. And give
Nice
it back.
try.
Nice try, but a lot of times parents do not expose their children to certain textures, to certain food, because they know or they have experience in the past a resistance. So I like the idea of food art, because it is, like you said, you don't have to eat it, we're just playing. And so it kind of desensitizes their awareness of, oh, they're going to force me, and they might. And I think, what do you think about this? Also, I know that the internet, Pinterest, a lot of other websites, or even just Googling, has a lot of food art options. That, what do you think about allowing the child to pick an art piece that they might want to do? Besides what's in the refrigerator, which I think is great because it's convenient.
Yeah.
You don't have to go spend any more money, what you said, but I'm anticipating parents who the child might, whatever they might have in there might be things that their child is not willing to try. So I would think that allowing them to pick the art that they want to do engages them through choice. What do you feel about that?
I like that option. The way that I like to set up food play is child-led too.
Perfect.
So I am absolutely going to put something on the plate that they know and is familiar. If it's goldfish, for sure. I'm not going to have all novel and new foods. A certain child may really enjoy the sequencing, the planning, the making the list, the going, the shopping. Absolutely.
Yeah.
But looking at the convenience for a caregiver,
Yes.
they do have food in their pantry that is preferred for the child. So I think doing a combination, and I did bring a variety of foods to show you. Would you like to see?
Yes.
Yes. Okay, great. So got some parchment paper here. I like this as a parent that wants to make it easy to clean up. As an OT, I still like things clean. I've got a couple of different things here. So I was saying that whatever you have in the fridge, and this is what was in the Blazina fridge today. So some leftover cooked noodles, spaghetti noodles. This can be a silly food face. And for a child that maybe needs some modeling, I think that's appropriate. I've got one, you've got one, but what I've really been leaning into is child-led opportunities.
Yep.
So while I feel comfortable touching these noodles, mostly, I'll be honest, using it to make hair as I'm making a food face. If your child is thinking absolutely not, that's okay. We've got other things to touch. So we've got freeze-dried strawberries, which is dry. Most kids are open to touching a dry food, much like a cracker or a cookie.
Yes.
And we've got some kale here. So I did bring out a variety of colors and textures. If you're not sure what your kid's going to go for, give them variety, see what's going to happen.
Yes.
And you get the opportunity. We've talked about fine motor. OT is always going to want to incorporate fine motor. So we've got some ripping. I am working on a face here. I've got some kale ears. If you do have a child that's a little unsure about touching, we've got some tools. So I love these like tweezers or tongs. Save your chopsticks when you go get sushi. You can utilize those. But this is my number one favorite. Toothpicks. So a kid
You're
that's
getting that pincer grasp.
yes, and even the visual motor integration. How do I pierce these? Sometimes I challenge them. How many can you get on there? But if I'm afraid to touch, I can still participate.
Yes.
And blueberries are a nice one because they're not They're not squishy, they're not wet, but I did bring some cucumbers to try with that.
And what I like of what you said is that the important thing is not to force them, not to make this.
Absolutely.
This is why I think that following that idea of,
It looks good.
look at that, yeah. I
Good.
like I realize those are actual ears, but they could be earrings.
Ooh, okay, all right, yeah. I like those too. And then, if food face is not your thing, I brought a car. You can make obstacles where we're driving around. But I also, another tool that I love, if you have any of these at home, this can make chopping an activity that promotes bilateral skill to stabilize, but in a child-safe way. We're always, safety is number one, regulation is number two, the rest is number three. But
There's your ears.
okay, I'm really liking her.
Put them in half.
Oh,
Yeah, you
okay.
see.
I like this.
I feel like this is becoming like this is the Puerto Rican with the big earrings. She's really cute.
Yeah, okay.
Yeah.
There you go.
So what do you think? Is this something that you would try at home?
Yeah, this is
I
great.
absolutely love it, and I absolutely agree that whatever's in the refrigerator just gets you started.
Yeah.
And then they can even make a list of, okay, what items do you want to use from the refrigerator, which is also working on their cognitive skills of having to plan, of having to make that selection. And you don't have to go out of the house. So for those of you who don't have transportation or something, the refrigerator and the cupboards are a perfect place to start and get going with some activity.
Reuse those leftovers, if you're tired of eating it.
Exactly.
Incorporate it in some food plate, because you get so much out of this. There's an opportunity for connection, because that's another piece that's really difficult with feeding therapy. We talked about the pressure at the dining table, and both people feel it, the child and the adult. But when you do something low key like this, and you're playing and you're with them and you're getting that connection time, that means so much, and that will carry over in a dining situation and eating situation. That's really important.
And I'm going to say this, Colleen, because I say this in almost every episode, okay? So
Okay, buckle up.
it just means that if you try it the first time it doesn't work, I guarantee you it might not work on the first occasion. Very seldom will work. Any strategy that we have ever mentioned here in the show, I always tell the parents, what is it I say? It's not a routine until it becomes a routine. So you're breaking their normal routine, which this is where children with autism, you're breaking their normal routine and introducing something out of the blue and expecting them to accept it on day one. Don't give up. Don't give up. Any strategy, not just this one, just any strategy, just insist. Repetition is the key, repetition is the key, repetition is the key. Just keep doing it. And eventually this becomes part of their routine. Having them engage in making choices is something that is going to elevate their willingness to do it, and keeping it low key, like you said, and keeping it you're not obligated to do anything. You can watch me, and eventually by repeating it, they're going to say, oh, what if we create a bear?
Yeah.
Or what if we create a palm tree?
It becomes easier the more that you do it, for you as the parent and the child.
Yeah.
So setting realistic expectations of it might not go well. Okay, I'm settling with that, and being able to still go through with the activity, and persistence is key for sure.
Yes, definitely. Awesome. So, Colleen, thank you for this activity. It's beautiful, and I'm sure the audience is enjoying this episode. But before we have to move on, I want to ask you, is there anything else you would like to share with our audience and let them know about you and your business?
Sure. So at this time, we are private pay, or we have the Step Up for Students Scholarship Unique Abilities, which is a great way to reach more families. We offer a unique model of occupational therapy. So I mentioned that before, that standard 1 to 2 times a week for 30 to 60 minutes, which is typical in outpatient settings. I wanted to diversify those options. There are families that receive weekly services, but I've also worked to create other options that might be more meaningful. I'm a huge believer in short-term and episodic care. So that might mean that we're with a family for 4 to 6 months, targeting a few smaller goals, and then giving that child and family a break. Go play soccer, go do gymnastics. Siblings have been taken to appointments a lot, and it can be difficult for a family and the child. And they benefit more from taking those breaks and circling back. So, you live that experience. So in thinking, how can I create meaningful therapy that looks different? I developed a feeding intensive. So that looks like I come to the home for a 2-hour evaluation, assessing the mealtime, seeing what's working, what's not working, taking everything into consideration, the family dynamics, the actual dining table, all of these things that are contributing to the child's successes or challenges with eating. And then I would come back to the home for 4 consecutive days and working and targeting on certain strategies, whether that be sensory, getting the parents down on the floor, we're playing, we're building that connection outside of the dinner table to make sure that they are in alignment there, so that when we get to the table and we're doing activities like this, the parents and child, they just have a better connection to be able to start what might be a little bit more challenging, and helping parents recognize that. And then we will connect weekly to make sure that those strategies are still effective. And we summarize with a 30-day video call to see if those strategies need to be tweaked, or if further parent consultation might be warranted, just to keep those strategies in place for the families. And then we're working with developing a 4-month feeding program, kind of what we had talked about with the 4 to 6 month treatment, with that being alternating 1 week with a parent coaching session, and the second week would be parent and child, and me facilitating those activities. Because what can happen in the outpatient setting is that you're not sure how to carry out these activities. Your therapist keeps telling you to try this, but you haven't really done it yourself. And so I want to be there to say, oh, okay, well, wheelbarrow walking, move your hands to their knees because they need a little bit more help. And in the moment, guidance and strategy. So that is another program that we have. Yeah.
So it sounds like just by the step up scholarship, I think is going to be something that is accessible for more families, number one. So thank you for sharing that information. We'll be sure to add the link to your website and your contact information in the comment section below, so that people can access you directly. So thank you so much for this presentation. I really enjoyed this show. So for those of you who are watching, remember, if you have any questions or comments for Colleen, let us know, and that's comment section below. We'll be sure to pass along those questions to her and those comments, so that you can get some feedback. And that's usually how we do it. We answer whatever we can, but we'll be sure to connect you with her. So thank you again. So we're almost at the end of the show at this time, but I didn't want to leave without making sure that we say thank you, Colleen, for having come. Yeah, it was beautiful. And also to remind our audience to please remember that we are coming on the 3rd Friday of each month for the most part. However, in December, there's going to be a little bit of change to accommodate for vacations and for all that stuff. So make sure to watch us on December 12th, when we are going to be sharing gift ideas for your loved ones with autism. So be sure to not miss that episode, okay? So that brings us to the end of the show. But before we go, I want to ask you a little favor, as usual, so that you go on the link below that we're going to leave you there, and let us know how we're doing. This kind of episode is something that it's really according to your life, and that you would like to see more. Remember that every time you do it, we go on the air, we need a new one. So even if you've done it before, it's real quick, 6 questions, that's it. So, but that does bring us to the end of the show. So please be sure to give us a like. Share this video on your page and with those that you know could benefit from it. And remember to meet us here on the 2nd Friday of next month, or the 12th, at 10:45 a.m. But starting in January, we go back to the third Thursday of the month, okay? So, Friday. Thank you. The third Friday of the month. So, thank you so much for meeting us here so we can share the scoop and spill the beans on important topics related to autism. But until then, we want to wish you good vibes and hot coffee. Thank you.
Bye, everyone.
Bye. Thank you.